Shoulder pain it's so frustrating, right? But what does the latest science actually say about how to fix it? Well, in this explainer, we're going to cut through all that confusion and go straight to the source, the official clinical guidelines for one of the most common causes of shoulder pain, rotator cuff tendinopathy. We're going to turn all that complex medical jargon into a simple guide you can actually use.
You know the feeling. You reach up into a high cabinet, or you try to throw a ball, maybe you just try to sleep on your side, and bam! There it is. That sharp, nagging ache deep in your shoulder. Yeah, it's super common, and as we're about to find out, there's usually a very specific reason behind it. So the official name for this thing is rotator cuff tendinopathy. Basically, it's all about the tendons, those strong, rope-like tissues that connect your muscles to your shoulder bones. And get this, it's a huge deal. The clinical guidelines show this one condition is the reason for more than half of all shoulder problems that send people to the doctor's office. That's wild. All right, so here's how we're going to break it all down. We're going to follow the whole journey right from the beginning. First, we'll dig into that nagging pain itself. Then, we'll see what a proper diagnosis looks like. After that, we'll get into the #1 treatment, look at some other options, and finally, map out your path to recovery. Okay, first up, that nagging shoulder pain. Let's really get into the problem itself. What is actually going on in there? So right off the bat, you got to understand this is way more than just a little ache. The guidelines are really clear that the pain causes real-world problems. You start losing strength, you might start moving your arm in these weird ways just to avoid the ouch, and for some people, it can even lead to this genuine fear of moving your arm at all. There's actually a name for that, kinesiophobia.
All right, that leads us right into our next and honestly super crucial step, getting the right diagnosis. Because trust me, how you get diagnosed can totally change your entire recovery.
So, what does a good diagnosis actually look like, according to the experts? Well, spoiler alert, it's not about jumping straight to a fancy scan. It all starts with a conversation. That's it. A doctor or a physical therapist who actually sits down and listens to your story. Then they'll do a hands-on physical exam, testing how you move and how strong you are. And of course, they're also checking for any red flags, signs of anything more serious.
And this is where we hit one of the biggest myths about shoulder pain. The official guidelines couldn't be clearer. In the early stages, you should not be getting an MRI or an ultrasound. And that grade F, it sounds bad, but what it really means is there's a strong expert agreement that this is the wrong thing to do as a first step. It's a big no.
Okay, so you might be thinking, well, when should I get a scan then? The experts say you should wait up to 12 weeks. If you've been doing all the right stuff, the non-surgical plan for 3 months, and things just aren't getting better, then, and only then, might it be time to talk about getting that picture taken.
So the crucial point here is pretty simple, right? A diagnosis should be based on you, not a picture. Getting that MRI too early, it often just doesn't tell the whole story. It can lead to a whole lot of unnecessary stress, extra costs, and even treatments you don't actually need.
Okay, so you've got your clinical diagnosis. What's next? Let's talk treatment. And the science here is, honestly, about as clear as it gets on where you need to start.
The #1, hands down, gold standard treatment is an active exercise program, period. This gets a grade A recommendation, which is the best you can get. It's the top of the charts. That means it's backed by a mountain of solid scientific evidence. It is the single most important thing you can do. But what does active rehab even mean? Because it's definitely more than just a few random stretches. A really good program has all these pieces: motor control exercises to help you move better, resistance training to get you stronger, exercises that focus right on your shoulder blade, and yeah, even looking at your neck and upper back. It's all part of a smart strategy to manage how much load you're putting through those tendons. But I know what you're thinking. What about all the other stuff? The pills, the injections, all that. Where does that stuff fit in? Well, the guidelines see these things as helpers, supplemental tools. They can be really useful for getting your symptoms under control, especially in the short term, so that you can actually do your exercise program. That's the key. But they are absolutely not the main fix. This little scorecard here breaks it down really well. So you've got your oral anti-inflammatories, things like ibuprofen. They get a grade B for short-term pain relief. Corticosteroid injections, same deal. Grade B, short-term help. Then you get to the fancier stuff, like PRP or hyaluronic acid injections, and, well, the evidence is pretty murky. They get a grade D, which basically means maybe, but the science just isn't there yet. And this point about injections is so important, we really need to hammer it home.
Even though they seem super common, the guidelines are explicit. They should not be the first thing you try. The pecking order is crystal clear. Exercise first. Everything else is just there for temporary backup if you need it.
Right, let's pull all this together. Final section. How do you take everything we've talked about and actually build a recovery plan that works for you?
You see, recovery isn't something that just happens to you. It's an active process. You're the one in the driver's seat. It's all about understanding what's going on, learning how to manage your daily life, and, this is the big one, slowly and steadily teaching your tendons how to handle more work again. That, right there, is the heart of real rehabilitation.
So let's just boil this all down to the key takeaways. 1. A good diagnosis starts with a chat and a physical exam, not a scan. 2. Active exercise is the single most powerful thing you can do. 3. Pills and injections, they're for short-term backup, not the main event. And 4. The best results happen when you have an active, educated partner in your own recovery.
And that really leaves us with one final and I think pretty powerful question. Now that you know what the best science says, you can look at your own situation and ask a simple question. Is my shoulder care actually built on the strongest evidence? Because having this knowledge, it puts you firmly in the driver's seat.